1.2.1 covers a number of different areas, but we're going to start off looking at somatotypes. This is Barbie. Barbie is an ectomorph. She has long limbs, narrow shoulders and narrow hips, and a low body fat percentage. Sports that suit ectomorphs would include high jump and long distance running. Buzz, typical mesomorph, wide shoulders coming into narrow hips, high muscle content. Suitable sports, sprinters, male gymnasts and swimmers. Mr. Potato Head, he's an endomorph. Generally, shorter limbs, narrow shoulders but big wide hips, high fat content. Particular sports that they suit, sumo wrestlers, maybe shot put, power type events. Got it? Now going to help us out with optimum weight. This is the weight that is best for you. Factors which affect weight include gender. More muscle and larger bones tend to be found in men. Height, taller people may be heavier, but not always. Bone structure. So small frame will weigh less than a larger framed person. Muscle girth, the size around your muscles. Bigger muscles weigh more. So performers in strength and power events will be likely to have more muscle, so therefore be heavier. Your typical top level sportsman will probably be heavier than most other normal average people their size. Related conditions. Anorexia. It's an extreme condition, a desire to lose body weight and become slim. It can be dangerous to health, as a person will lose more and more weight as it goes on. They will sometimes have a different perception of their body to what is actually true. Obesity. An obese person is someone who is very overfat. This is the most dangerous condition of all the weight conditions. These people will often find exercise difficult. Overfat, a way of saying you have more body fat than you should. These again will probably find exercise difficult. Overweight, having weight in excess of normal. This is not always harmful unless it is due to being fat or overfat. Some sports performers may be overweight due to the high levels of muscle. Underweight, weighing less than is normal, healthy or required. May make sport difficult due to a lack of power or strength, and some sports may require a very low body weight, such as a jockey. Drugs. Drugs can be divided into two types: recreational and performance enhancing. Recreational drugs include cigarettes, smoking, alcohol. Smoking damages the cardiovascular system. It also damages the alveoli in the lungs, a part of the respiratory system. It can lead to cancer and coronary heart disease. It is certainly going to affect sports performers in endurance events. So endurance athletes will struggle because they will have less O2 getting into their body. Alcohol. This has many side effects, including dehydration, producing extra urine. It slows your reaction time and reduces coordination. These will affect sports performances as it will be more slowed down, and you will find things like catching and so on more difficult. Performance enhancing drugs are divided down into different categories. We have anabolic steroids, which allow the athlete to train harder, to recover quicker and to build muscle mass faster. Sports that tend to use this tend to be athletics, and in the past there have been numerous sprinters that have been found to have steroids or anabolic steroids in their body. The side effects include an increased chance of heart attack, high blood pressure, infertility and maybe even liver damage. Beta blockers, these slow down heart rate, have a calming, relaxing effect, would help sports performers in sports such as snooker, archery and shooting. Side effects include nausea and diarrhea, tiredness, depression and even low blood pressure. Diuretics, these help you lose weight through increased fluid loss, helping you go to the toilet more. Sports that this would help would be boxing and horse racing, where it is important to maybe meet a weight category. Side effects include dehydration, obviously through the fluid loss, headaches, dizziness, and maybe even kidney failure. Narcotic analgesics help reduce pain, therefore masking the injury that you may be suffering from, allowing you to keep performing. These could be used in numerous sports. They can though cause a loss of concentration, balance and coordination. Stimulants increase alertness. They are helpful in sports where you need to be focused in difficult situations, such as American football, maybe a football goalkeeper trying to stay alert. Side effects include insomnia, anxiety, irritability, increased and irregular heart rates, and maybe even high blood pressure. Peptide hormones, including erythropoietin or EPO. This increases the number of red blood cells. Therefore, they're helpful to an endurance athlete. So, also people that take part in the Tour de France cycling event, as it enables you to keep performing for longer. Side effects include a thickening of the blood, increased risk of heart attack, or even a stroke. Cut it there. Assessment and preventing injuries. There are 6 ways of reducing risks and preventing injuries. The first, warm up and cool down. A warm-up can prevent injuries by preparing the body for more vigorous exercise. It helps reduce the risk of pulled muscles and strains. A cool-down doesn't prevent injury, but does help disperse lactic acid and prevent muscle soreness the next day. Checking equipment and facilities. Officials normally check the equipment and facilities are safe so that they do not cause any injury. Facilities that are checked may include the pitch or playing surface to check it is not frozen or waterlogged. Equipment is in good condition and set up correctly, such as goalposts anchored down or in good working condition, unlikely to foul. Carrying out a PAR-Q is another way of reducing risks. PAR-Q involves a physical activity readiness questionnaire, such as the example being shown. Should be taken before starting exercise or a training program to assess the health and fitness of an individual, looking for any possible conditions that may prevent or limit the exercise they can do. Balanced competition. This is to make sure that competition is safe and fair. You would not want a child competing with a fully grown adult, as this will increase the risk of injury. We can balance competition in various ways. We balance on weight, gender, age, and maybe even a handicap level, such as the level of your ability in the belt system used in karate and judo. Playing to the rules. Why do we have rules? Basically, to keep the performers safe and keep the game fair. But the safety aspect is essentially important to officials who make sure they enforce rules such as no two-footed tackles, no tackles from behind. In boxing, no punching below the belt. Protective clothing. Protective clothing is an obvious way of preventing injuries. Examples include shin pads in football, a helmet in cricket, maybe a gum shield in boxing. In some sports it may even be compulsory. Correct clothing includes wearing things that are suitable for sport. For example, a tracksuit, so you can move freely. The correct shoes, which have grip. Football boots, which will prevent you from slipping on a wet surface. Another thing to consider is the removing of jewellery, etc., which can also be dangerous.